Hey, it's Mo Egger. It's football season, and there's no better place to post up to watch the games than Long Neck Sports Grill. Start with the TV setup. There's 4K TVs all over the place, and the sound is on for all the big games. Then there's the menu. It is awesome, and it's extensive. I love the wings, and of course, you need beer. No place has a better beer selection than Long Neck's. 3 Northern Kentucky locations, Wilder, Hebron, and Richwood. Long Neck Sports Grill. Stay late. Come often. It's 4:35 on ESPN 1530, OrthoCincy Mo Egger Show. Speaking of OrthoCincy, they are our go-to guys, men and women, when it comes to injuries, right? And so we chat with one of their doctors every single Wednesday, and I'm joined today by Dr. John Fritch, OrthoCincy. By the way, there's 12 locations in the area. If you need them, no appointments ever necessary, and they've got locations with evening hours and Saturday hours for your convenience. Learn more. Go to OrthoCincy.com. Dr. Fritch, I appreciate the time. I want to start with DJ Reader. And look, there's not a lot of specifics that we're dealing with here, but we do know he's not going to play tomorrow. Do know that he's not going to play for a while. The good news is nobody seems to believe that his knee injury is going to require him to miss the rest of the season. So I guess we're dealing with a lot of possibilities here. Walk me through this. What could we be dealing with when we talk about an injury that's not severe enough to cause him to miss the season, but is severe enough that he's going to have to miss a couple of weeks?
So still some speculation here. Based on what they have announced, though, it sounds like he's not going to need any season-ending surgery, so not an injury similar to Joe Burrow, who needed his ACL and MCL reconstructed, so that's good news. Possibilities, he could have a sprain to one of his ligaments. The most common one would be an MCL injury. Generally, those sprains or partial tears to the ligament will heal without a surgery, but might take 4 to 8 weeks to fully heal. That may mean that he's able to practice in a little while, but it sounds like he's not going to be able to play for at least the immediate foreseeable future. Other possibilities, it's possible he has a meniscus tear. Those are essentially the shock absorbers in your knee. Sometimes those require a smaller surgery, an arthroscopic procedure that people can potentially come back from during the same season. So those are the possibilities. I think it's definitely reassuring that he'll be back this season, but still not really sure exactly what happened to him. So we'll have to wait and see.
Let's talk about 3 different quarterbacks, starting with one who's going to be in town tomorrow for the Bengals-Dolphins game, and that's Miami QB Tua Tagovailoa. And I saw the footage of him staggering to his feet, hitting the deck after his head hit the ground. And so the first place my mind went, and I think the first place most of us went, was, okay, concussion protocol. He's going to have a head injury, and he's probably not going to re-enter the game. He did come back to the game, and the explanation was, well, he's been dealing with a back injury. So I guess my question, and it might be a dumb one, can back injury symptoms mirror the symptoms from a possible concussion?
Yeah, so definitely an interesting subject, because I watched the same footage as you, and I was a little shocked at first as well. You see him staggering around on the field, you think he's seeing stars, you think he had a concussion for sure. It is possible that a back injury did lead to his symptoms. Back injuries can certainly cause abnormal posturing and difficulty moving, especially right when they happen. You can get some transient muscle spasms that might explain, I think he said he felt like his back was locking up, and maybe that's what was explaining what was going on there. But to be honest, taking a look at the video footage, I was kind of shocked to see him come back out after the half. It looked a little more like a concussion to me.
What does someone with your background, a medical professional, because as a sports guy, we talk about the concussion protocol the NFL has all the time, and frankly, from a less than educated vantage point, what is a medical pro's view of how the league is handling head injuries these days?
Certainly. I mean, head injuries, especially with us recognizing CTE as becoming an incredibly prevalent disease amongst football players, has been pretty stringent. I mean, they have a very specific protocol about how to safely return our players back to the game. Usually most games, they have multiple observers present to look for any subtle signs of concussion. They have an independent neurological physician evaluation prior to letting them to return to play. Their protocols, along with most other protocols for college and high school level sports, involve graduated return to activities, meaning they have to pass multiple steps along the protocol and have to spend a given amount of time in each step along the way to be sure that they return safely. And so, from looking at the league's protocol, it seems very stringent in terms of making sure that we identify these people that have had a concussion and make sure they take the appropriate time to return back to play. And so I'm impressed with their particular protocol, and it hopefully helps prevent any future head injuries here.
I want to talk about Justin Herbert of the LA Chargers. So he played despite the week prior suffering a rib cartilage fracture, which sounds exceptionally painful. Now, I've never had broken ribs. I don't even know what rib cartilage is. So tell me the difference between a rib cartilage fracture and fractured ribs.
No, absolutely. So a rib cartilage fracture is similar to a break in a rib. Essentially, the ribs, as they start from your back and wrap around the sides of your chest and go to the front of your chest and attach to the sternum, in the very front of your chest, it turns into cartilage. And so a break in that cartilage is essentially a lot like a break in a rib. Just fractured ribs are fracture to the bony part, and a break in the cartilage is a break to the cartilaginous part.
In terms of protection, because he played through it, he was in the game much later than I think he should have been. They lost by 28 points. But how do you protect a player who's going to take hits to his midsection, especially as a quarterback when you've got when you've got fractured rib cartilage?
No, absolutely. It's tough. I mean, you got to pad these guys up really well, and I mean, at the end of the day, they're just tough dudes. These are really painful injuries. You got to be sure people are getting nice deep breaths, and a lot of times these injuries are painful enough that prevents you from getting a deep breath. And so a big part is spent helping to treat the pain. Sometimes we use lidocaine patches. You might remember Tyrod Taylor, unfortunately, getting a collapsed lung when they tried to do a nerve block, but sometimes people perform nerve blocks to help with the pain. What
are the treatments for an injury like that? I mean, there's the pain management, but then there's the actual, handling of the actual injury.
Yeah, absolutely. So with these rib injuries, I mean, in general, they all heal on their own. Particularly for isolated rib injuries, if there's only one fracture or one break, we just protect them and let your body heal it up. Potentially, I mean, in a trauma setting and people with a collapsed lung and multiple rib injuries, then sometimes they do get plated with a surgery. But, I mean, this is very infrequent, especially amongst the athletic population.
All right, one more. Another quarterback, Mac Jones. So he suffered a severe high ankle sprain. There is a still photograph of him coming off the field, and he looks like he's in extreme pain. I've suffered an ankle sprain. I don't know that I have suffered a high ankle sprain. What's the difference between the two?
A regular or common ankle sprain is a tear or injury to the ligaments surrounding the ankle joint itself, usually between the fibula or tibia and the talus, which is the bone down in the ankle joint. High ankle sprains are a little more severe because they require more energy to happen. It's a tear to the various ligaments above the ankle joint. That's why they call it a high ankle sprain. The ligaments make up what's called the syndesmosis, or the connection between your tibia and fibula, your shin bone and the bone on the side. And it affects the ankle stability a lot. It's a lot more painful, too, pretty severe. I mean, it was tough to see Mac deal with that injury.
What's the treatment for an injury like that, and what is the typical recovery timeline?
That depends on the severity of the injury. And so generally, most of these injuries are treated without a surgery, but they're more severe than just a common ankle sprain. Usually it involves a period of limited weight bearing, meaning putting them on crutches and putting them in a brace or boot or splint for the first 2 weeks or so, and then gradually progressing them back to play. Most people can return to play in about 6 weeks, but again, that depends on the severity. Some of these do need a surgery. So there are some severe high ankle sprains that become unstable, where the tibia and fibula are no longer connected together. And then we have to go in with a surgery and either use screws or suture fixation devices to bring them back together and stabilize them. You might remember Tua back in his college days had that, I think, right before the college football playoffs. And he was fortunately able to return.
Dr. John Fritch, OrthoCincy. Check out the professionals at OrthoCincy at OrthoCincy.com. Insightful stuff. I appreciate it. We'll do it again, man. Thanks so much.
Of course. Thank you.
All right. Check out OrthoCincy.com. 12 area locations, flexible hours, no appointment ever needed. Brennan and Jones on baseball coming up, and former Bengals running backs coach Kyle Caskey is going to tell us how can the Bengals fix their running game. That coming up at 5:05. We'll preview the UC women's basketball season next. OrthoCincy, Mo Egger Show on ESPN 1530. Hey, it's Mo Egger. The big question this football season, where are you going to watch all the big games? I've got the answer. Long Neck Sports Grill, 3 locations in northern Kentucky, Wilder, Hebron, and Richwood, each of them very easy to get to. The TV setup is unmatched, 4K TVs all over the place, and the sound is on for all the big games. You can't top the menu. I love the wings, and no place has a better beer selection. That's most important. Long Neck Sports Grill, perfect for football season. Stay late. Come often.